Okay, so unfortunately we don't have an extra battery to be able to check the ears, but I just kind of want to go over what you would check. So what you would check would obviously be the external ears. Okay, this side looks good. She's got some piercing holes, but that's, normal. And same way with this ear. Nothing behind her ears, as far as lesions, abrasions, anything like that. And then you would go ahead and you would look in the ear. You would check out the inner ear, check out, if there's excessive earwax. Excuse me. You would check the tympanic membrane and the inner canal and all of that kind of thing. So the other thing that we would do for hearing, which is what I'm going to go ahead and do, we'll go ahead, I'll set this down. I'm going to do what we call a whisper test, okay? So what that whisper test is we have you cover the opposite ear of the one that I am near. Okay, so yes, your right ear is the one that she would cover. And then you go ahead and you whisper whatever words, things like that, and kind of assess her hearing. So that's what I'm going to do. So I'm going to whisper something in your ear, and I want you to repeat it back to me as well, okay? So, 1, 2, 3. Okay, I'm going to go over to the other side. I'll have you cover that other ear, and I'll speak again and have you repeat. A, B, C. A, B, C. Okay, so very good. So that would be the only other thing that hearing-wise I would check. I'll go ahead and set this down over here in my equipment, and I'll wash my hands one more time. So now we'll go ahead and we'll move on with your neck, and we'll do an assessment on that. General appearance, once again, visible lumps, lesions, anything like that. You do have a little bit of redness, but do you know what that's from? Do you know if that's just irritation, or is it, I know you kind of get red skin kind of when you get nervous or anxious and stuff. So I appreciate you bearing with me. So we're looking, like I said, nothing looks abnormal, no lesions, nothing like that. So we'll go ahead and we'll kind of inspect. What we'll do is check the lymph nodes of kind of the head and the neck area. I'll take a look at your carotid arteries, and then we will go from there. So you want to assess kind of right here in the front, using the pads of my fingers, kind of feel around, and right behind the back of the ear, kind of in the occipital region here. Okay. Okay, nothing feels abnormal, nothing feels swollen. Have you ever had swollen lip glands?
No.
Before? I know sometimes, you get a sore throat, all that thick drainage, things like that, you can get a little bit sore right here. So I have noticed that before myself. So have you ever experienced that with, sinus drainage and things like that? Just kind of draining. So, but nothing is abnormal, excuse me, as of right now. So I'll go ahead and I'll assess here with the carotid. Sorry, I'm going to press a little bit more firmly. Okay. Good flow, both sides plus 2+, so everything feels good. And then the last thing you kind of want to look at is the thyroid, okay, and the larynx. So have you ever had any voice issues, any thyroid issues?
No.
That you know of? Okay. No synthroid for you then. Okay. So when you go ahead and you kind of use the right side, if you're checking it from anterior position, you'll go ahead and kind of displace it a little bit and go behind that muscle on this side. Okay. Everything feels normal. It feels good and it feels normal inside. Size here. Kind of feel this way. Okay, everything feels normal. Okay. Yep, everything feels good there. Have you ever had any breathing problems, any swallowing problems, things like that with food? Okay, just making sure that your larynx is healthy. So that's good. And no surgeries that you know of anywhere. Nope. Okay. So that's always good. So I guess if it's okay, I'll go ahead and what we can do, we can look in your mouth. Is that okay? Okay, I'll wash my hands specifically for this just because, you know, we won't touch anything, but that way we can use the tongue depressor, have fresh, clean hands, and if it's more comfortable for you, if you prefer, you know, you can hold the tongue depressor. I know some people, this is the worst, not very fun part. So, would you prefer to hold it?
That's fine, I'll hold it.
Okay. All right, and unfortunately the light went out on that, but I do have a flashlight. So unfortunately we couldn't check the inner ear because obviously that would take something, you know, specific tool, but I can go ahead and look in your mouth. So what I'll do is I'll have you have that tongue depressor, okay? And I'll do this first, kind of get it out of the way. It's the most uncomfortable part of the checking of the mouth and everything that goes with it. So what I'll do, I'll have a Q-tip and I'll check both sides. I'll check kind of to the right and or to the left in your case because you're turned kind of opposites, left and right. Okay, so just whenever you're ready. Okay, everything looks good. So, okay, I'll let you rest for a minute. I understand it's very comfortable. Okay, and then I'll go to this side. Okay, perfect. And we'll be done. So I'll go ahead and put my applicator there. Perfect, and I can take that from you. Awesome. And I'll go ahead, and if you don't mind, I'll go ahead and look in your mouth. So I'll have you kind of open for me. Good. Sherry stuck out her tongue. I was going to have her ask her to have her tongue out for me. Okay. Tonsils look great. Everything looks moist. So, can you lift up your tongue? Okay. All right. Any cavities that you know of?
No.
I couldn't see any. So, perfect. Well, you must take really good care of your teeth then. Awesome. So, everything looks good. Her buccal mucosa there is moist. Back of her throat is moist, red, has some veins. That's little capillary, sections back there. Her tonsils are appropriate in size, nothing is swollen. And her palate looks good, underneath her tongue looks good. She stuck out her tongue for me. So can you say ah for me now? Ah. Okay, perfect. So everything, I'm sorry. Everything is working correctly, you know, with that area. So, like I said, teeth look good, no cavities. That's awesome. So, we'll go ahead. I'll set that back down there. And we'll go ahead and I'll just kind of wash my hands again and kind of clean up my mess. So what we'll do next is we will go on to assessing your chest, if that's okay. So this is kind of the fun part. You get to get moving. Yeah. So we get to have you stand up for me if you could, and I'll stand up with you. So kind of breathe in and kind of shrug your shoulders for me. Okay. Her shoulders rise and fall with, you know, equality. So everything looks good there as far as symmetry. Everything with her chest looks good. We'll check symmetric expansion. So I'm just going to kind of stick my hands underneath here, okay? and across your rib cage, my thumbs and my fingers. I'll just have you breathe in. Okay. So her rib cage, her chest, everything rises and falls equally. So everything looks good there. So what I'll have you do, this is the part there is kind of long, and I apologize. We'll kind of do 3 different things with your lungs, and it's basically 3 full assessments.
Okay.
So what I'm going to do first is something called tactical frontis, and kind of, it's the palpable vibration. Okay? So when you speak, I'm going to feel it in your chest, and we'll kind of have to go from spot to spot. Do you mind if we take off your jacket?
No.
Okay, perfect. So then you kind of get a better look of where we're at. Okay, thank you so much. So we'll go ahead and we'll kind of just say, ah. It's kind of hard in that area, sorry. Okay, so it's going to vibrate on the anterior side. So I'll kind of have you kind of turn just right there, perfect. And I'll kind of go posteriorly and check along your back side. So go ahead for me. Okay, so I'm assessing, and I'm going across, down, kind of like a zigzag pattern. And then same way with the back, you know, start in one spot at the top, then follow with that same spot down. So that's what we're doing there. And if you don't mind, we'll go ahead, we'll listen to your heart here in a little bit, but we'll go ahead and kind of get all that lung stuff out of the way. It's kind of the longest part, so if you don't mind, we'll go ahead and have you breathe, and this is where I'll check your breath sounds.
Okay.
So, okay? And if you feel more comfortable sitting down, I just know sometimes when we ask you to take a deep breath, it's a little bit easier if you're kind of standing and prepared. So, okay. Make sure here. Okay, I'll have you breathe in for me. Okay, we'll do the same thing back here for me, okay? Breathe in, breathe out. Breathe in. Okay, everything sounds clear anteriorly, except for, you know, in the lower areas and in your bases back here put on the posterior side. It's a little diminished, but I mean, you know, really I don't see that much unless we're exercising, you know, we're really opening up our lungs, so sometimes that's common to hear. So the next thing I'll have you do is I'll go ahead and I'll place my stethoscope in my ears. What I want you to do when I place it in those certain sections, just say 1, 2, 3.
Okay.
Okay? And I'm listening for that in my stethoscope, and I should be able to hear it clearly. It will be very faint, but I should be able to hear it very clearly. So we'll go ahead. Okay. Breathe. Or say 1, 2, 3.
1, 2, 3.
Okay.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay.
1, 2, 3.
Okay. And the same thing on the back.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
Okay. Kind of going on that lowest side on that ninth interfrontal space.
1, 2, 3. 1, 1, 2, 3.
Okay. Perfect. So I can hear that. And if you want to put your jacket back on, you're more than welcome. Kind of leave it open to that chest area so that when I go to assess your heart sounds, that we can do that. I'll go ahead and I'll go on to that next.
Do you want me to sit down?
Yeah, that would be great. Okay, so what we'll do next is we'll go over the heart sounds, and we check for the 4 valves. I remember it by the term all physicians, think milk. All physicians try milk. Try milk, that's what it is. Look, I can't even remember the phrase. That's okay. So aortic, it's kind of on the right side here, 2nd, 3rd intercostal space. Pulmonic, tricuspid, and underneath 5th and 6th midclavicular line is the mitral valve. So as per the assessment, we'll go ahead and I'll listen to it with the diaphragm first, and then we'll go ahead and kind of switch it over here and we'll take a listen to it with the bell. We're just listening for those heart sounds and the love dubs and making sure that the heart rate is regular. And so at the end of it, when I get to her mitral valve, that's the apex of the heart, and we go ahead and we listen to what we call the apical pulse. So we'll go ahead, and if you don't mind, I'm sorry, hun, if you don't mind, I'll go ahead and take a listen. Is that okay? Okay, so clavicle, 2nd, okay. Okay. And that was the aortic, and this is the pulmonic. Okay, and with your shirt and your bra and everything, it's going to kind of hard to get in there, but I'll kind of move everything out of the way. Is that okay? Don't want to make you uncomfortable. Okay, that's tricuspid, and then I'll have you, for comforting purposes, we'll have you lift that up, and I will take a listen underneath here, kind of underneath your bra. Okay, and we'll go ahead, and if it's okay with you, if you're still comfortable, I know it's an uncomfortable position to be in, we'll go ahead and take a listen for a minute and count your apical pulse, okay? So I'll just stare at the clock here and we'll count. Okay, so your rate was regular, and it was, or your heart rhythm was regular, and your rate was 62. So, is that about average for you? Do you ever check it? Kind of.
Whenever I go to the doctor, that's usually what it is.
Usually about what it is, okay. And you don't have any heart history, any valve replacement, stents?
Nope.
Okay, okay. Well, good to know, yeah, because it sounds like it's beating healthy. So, yay. So, once again, I just want to go over and make sure that I covered with you guys when I listened the aortic, pulmonic, tricuspid up here, you know, and then down here in the fifth and sixth, in between there in the mid-clavicular line. That's where we assess your mitral valve, and that's the apex, and that's where we take your apical pulse. So, okay, are you doing okay? Do you need to pause, take a break, or no? Okay. I just want to make sure that you're doing okay. I know. Thank you so much for bearing with me. It's quite the assessment. So, as far as what we need to do next, we'll go ahead and we've done your heart and your lungs, things like that. If you're okay with it, we'll go ahead and we'll go over your abdomen and kind of get that out of the way. Okay. And I'll kind of try to tell them right now kind of what we are going to be assessing and things like that. So that way, you know, I don't have to have you, you know, here feeling uncomfortable at all. So we'll go ahead and we always auscultate before we palpate because especially with vowel sounds, you can stimulate the artificial sound, so you may be making those vowel sounds happen when in fact there may not be. So you always want to try to do that first, and that's kind of what I'll start with. I'll look at your skin color and the general appearance of your belly, and note any asymmetry with your belly. Look at your umbilicus. Do you know if you have any history of hernias or anything like that? Okay, so really nothing abnormal. Have you had any belly surgeries? You said no. You said you've never had any surgeries. Okay, I just always try to make sure I go over things and double check when I do assessments with this, because it's kind of nice to get kind of the health history in the background as you do the assessment. And those are questions that are easy to ask, and people, if they don't know, I mean, you can always look it up in their chart, but that way you kind of get an overall idea. So, if you don't mind, I'm going to go ahead. Would you like to lay just for a minute? And I hate to wish I had a pillow for you.
That's okay.
I'm not being very friendly to you. So we'll go ahead. I'm going to kind of move this out of the way. We'll take a look at her general appearance. I'm going to kind of crouch down towards you, okay? Oh, my knees popped. Sorry. So general color and appearance, everything looks good. She's got good color. Everything is pink. Nothing is abnormal. So before I do anything with pressing on your belly, things like that, like I said, I'm going to listen to your vowel sounds, okay? Okay. Do you ever have problems with constipation, feeling backed up, things like that? Okay. So I'll go ahead and listen here. You're growling at me. Yeah, you're definitely roaring. Okay, so you like to listen, you know, usually 10, 15 seconds if you don't hear anything within the first 5 seconds. Usually about 5 seconds is sufficient. So what you do with the abdomen is you cut it into 4 quadrants, and you check off in each quadrant. So you get all areas of the colon, so you get, you know, the ascending, the transcending, and the descending colon, so you kind of get all areas of that, and you're able to get a really good feel for everything that make sure that everything is working okay. So in this case, everything with you is working great. So we'll go ahead, and if you don't mind, I'll kind of listen for your abdominal aorta there. Really shouldn't kind of hear. Okay. I can hear it just fine. It's not, it's regular. Stethoscope is switching on me. Okay, everything sounds good with it. So as far as that goes, I'll kind of palpate. Okay, and I can feel that pulse flowing through you. And if you don't mind, I'll go ahead and what I'll do is I'll kind of press on your stomach. Okay, and your rolling motion, does that hurt? Is that tender? We kind of like, we'll go ahead, and that's okay for you to close your eyes, but you kind of like to look at the patient. Does that hurt? Okay, does that hurt? Okay. Not at all, not tender. Okay, okay. And then as far as that is concerned, you want to look at them because sometimes, you know, they'll say, oh no, I'm not hurting, but you know, you're pressing and they're wincing. So it kind of gives you an idea if there is a little bit of pain. They're trying to be strong, trying to be tough, and you can always kind of assess it that way. We'll go ahead and I'm going to kind of percuss on your belly, kind of up here at your chest too, to kind of see if I can find a border. Now with women, I mean, it's kind of hard because, you know, you have breast tissue in the way. So usually where your rib cage is, even still underneath that is some of your liver. So it's kind of hard to find those borders. Mm-hmm. So, but we kind of, okay. So about right here. Is that bothering you at all? Okay, I don't want it to be painful. So at least right here is where the edge is, and we'll go ahead and make sure your shirt stays. But you can also kind of tuck under and kind of feel the edge of the liver. So you can feel it right there. I can palpate it. Can I have you take in a deep breath? Okay, just kind of a couple deep breaths. Okay, kind of a couple deep breaths. Okay. Using a two-handed technique is also kind of a way that you can palpate an organ that's kind of underneath you. So you can kind of hook method, you can percuss, and you can also use a two-hand where the hand on top is applying the pressure and you're kind of using the bottom hand to inspect. So everything feels good there, and you've never had any liver issues, never had any abnormal liver enzymes, anything like that. Okay, and then as far as that is concerned, we also check your spleen. And you can kind of use the same techniques. So I'll kind of have you breathe in and out, and you want to have them breathe in and out. It kind of helps be able to assess. So go ahead and breathe in and out for me. Just slow, you know, big deep breaths. Okay. And everything feels okay there. Another way I forgot to mention is you can do a two-handed technique and kind of go under them and kind of use that to press up and squeeze together. So that is always helpful. So thank you so much for being such a good sport. I'm terrible. I didn't even get you a pillow. But you're being a good sport. I appreciate it. So if you want, you can go ahead and sit back down. So we'll kind of review what we just listened and looked for. So we like to check the bowel sounds, make sure that the bowels are active, that they're not active enough, or we have a problem where they're, you know, hyperactive, where you're maybe going to the bathroom and not feeling too well. So your bowel sounds were great. You had great bowel sounds. Palpate the liver and the spleen for any kind of masses, inflammation. You know, your spleen can be inflamed, you know, if you have, you know, illness such as mono. You can be enlarged. So somebody that maybe exhibits those certain types of symptoms comes in, it'll be tender to that area. No tenderness when I pressed, was there? I know. Those are always hard too, you know, because you have to press a little bit more firmly. So that deep breathing kind of helps you expand and kind of focus on your breathing. So I'm glad that wasn't too uncomfortable. So I guess what we'll do is we'll go ahead and we'll move to musculoskeletal. So that deals with your musculoskeletal system, how your muscles in your skeletal system, you know, they kind of work together to make your body work, make your body move. So this is the fun part. Yay! I told you we were going to get moving. We already had you on the floor. And then so if you want, if you could, do you mind to stand up for me? Okay, so we'll kind of check general range of motion. Can you kind of roll your shoulders back for me? Okay, everything feels okay, nothing's tender. So I'll kind of pull your arm outward and up. Okay, tell me if you can't ever tolerate that. Does that feel okay?
That's fine.
Okay, we'll kind of move back. Okay, does that feel okay?
Mm-hmm.
I don't want to go too far. We'll kind of go forward. Okay, and upward. And my arms aren't long enough. Down. Does that feel okay?
Mm-hmm.
Okay, we'll kind of do the same thing with this side. So I'm kind of feeling your shoulder, you know, your rotator cuff joint. So we're going to go up. We'll go in. We'll go down. I'll have you kind of come out again, and I'm going to switch here, and we'll go backward. And we'll go forward. Okay, everything feels okay. Can you move your arms inward, elbow joints? So also, you can assess the joints really with this section. I know there's a separate little section for the joints and everything like that. You don't have any joint problems, anything like that. Okay, yeah, because your joints and your muscles and your bones all kind of work together to kind of get you moving and get you where you need to go. So that really can affect you if you have loss of motion in a certain area. So I won't make you exercise too much, but if you wouldn't mind kind of pulling up your knees, okay? Do you have any difficulty with that?
No.
Okay, perfect. Should make you try to lunge here. So can you kind of move your leg out? Okay, and move your leg out. Okay, perfect. I know everybody's not, perfect because we're not all, athletes. We can't all get it right, but no, that's okay. So you don't have any issues moving from side to side. And then also, can I check the range of motion while I'm at it in your spine?
Mm-hmm.
Okay. Kind of go down. Can you touch your toes for me?
That's probably about as close as it's getting.
Well, that's okay. Your arms are a little bit shorter. I got longer legs than that, so longer arms. So I'm kind of built lanky almost. Wish I was a little bit more lanky, but that's all right. So, you don't have any deficits that you know of?
Nope.
Okay. So if you don't mind, can you sit down in the chair and we'll kind of go over some range of motion. So kind of scoot your bottom to the edge there, okay? And we'll kind of have you pull your hip outward, okay? About as far as you can go, okay? So kind of that side movement of your legs is doing well, okay? Okay, and as far as your knees and extending your legs out, which is good, people that are older often have muscle atrophy and they have range of motion issues. You get older and you get more stiff and arthritis and things like that, so that's always something to watch out for. I know moving your knees, it's hard when you're walking around on that floor all day. My knees kind of cringe every once in a while, so I don't know how yours do, but mine, sometimes I have to get supportive soles in my shoes because my knees get rough. So, and then as far as neurological. This is kind of where the reflexes come to play. We'll go ahead and, if you don't mind, I'll go ahead and I'll do it first. We'll go ahead and do the Babinski. Is that okay? So this requires that your socks come off. So sorry about that, hun.
I did have surgery on this foot.
On this foot. This was the bunion.
Mm-hmm.
Okay, so yes. So I noticed that she has probably a good, 3.5 inch scar on her foot. She did have a bunion removed. Okay, so I'll have this relaxed, and we'll kind of check it on both sides. We'll go ahead. And what we do when we test for the Babinski reflex, we check and see if your toes kind of curl inward. That's normal. You know, on a baby, it's normal for them to flare out, but it's abnormal. You know, so somebody with neurological deficit, like a stroke, things like that, they may flex back. So if you come inward, and that's by running your reflex tip down here. Is it tickle? See, okay, and your toes went inward. So that's normal.
Okay.
So we'll go ahead, and before I lose your toes here, we'll kind of do a look over on her lower extremities. Her skin looks good. Recently shaved. Wonderful. Wonderful. Cap refill. And I'll check your other side here, and we'll kind of do your pulse real quick before I forget. And then I wonder if I can feel it through your popliteal pulse. And then posterior tibial pulse, popliteal pulse, and pedis pulse on her left side is good. So, and her Babinski reflex was good. So we'll check this side here. I know we kind of do a head-to-toe assessment, but some things it's just kind of easier to wait to look at your skin color and your pulses and stuff. Well, I've already got your foot out. I don't want to have to make you work harder. So skin color is good on this side. Pedal pulse is good. Posterior tibial. I'll go ahead and go under and check your popliteal. Everything's 2+, so everything's good. So we'll check the cap refill here. Okay, and then I'll go ahead and take this hammer and we'll do the Babinski, okay? So kind of draw 7. Okay, that's okay. I'm done torturing you. I'm done torturing you. So you can put your socks back on, and her toes came inward, or rather turned downward. Turned downward. So everything with that was great. Okay, and we'll go ahead, and we'll do like a sensory touch and perception test, okay? So I'm going to use this fun little tool. It's kind of like a spur. It's not very fun, I know. I'll be gentle though, so it's good. So I'll have you kind of close your eyes, and whenever I touch you, just say that, yeah, now or yes. Saying that, yes, I can feel you. Yes, I can feel that. Okay? So I'll kind of do certain areas. Okay? So I'll go ahead and...
Yes. Yes. Yes.
Okay, I'll borrow your legs here. I hate to do that, but we'll go ahead and... Okay.
Yes. Yes.
Okay, perfect. And then the other thing I'll have you do while you're down there, go ahead and when you take one leg, we'll go ahead and run your heel down your shin, okay, and do that. Okay, if you could repeat that a couple times for me, just do it up and down and up and down. It makes it a little bit easier for you. There you go. Awesome. Okay, and then the other side just a couple times. So you have that fine motor function, kind of realize, have that sensation. So we'll go ahead and before too long, I'll check your reflexes. The fun part, yay! But we'll also kind of your fast-acting reflexes and your movement, coordination, things like that. We'll go ahead and kind of have you place your palms here, okay? And we'll go ahead and have you flip to your palms and do that quickly. So as fast as you can. Okay, perfect. So no issues there. All right. You know what? One thing I will do as well, before I check your reflexes, I'll have you stand again. We're just having an exercise party. So what I'll have you do is what we call the Romberg test, and that helps with balance, making sure that you have okay balance. So as close as you can get your toes, and as tight as you can get your arms in. It's like you're in a little box. So go ahead with their eyes open. You can assess. Everything looks good. So I'm going to stand backwards a little bit here. Okay, no swaying. That's what you're going to kind of look for. And as normal, you're going to have them close their eyes. So kind of just try to balance. I see her swaying a little bit. Okay, that's good. You can open your eyes. You see her swaying a little bit. A little bit is okay. It's just when you can go ahead and sit down, hon. It's just when you notice that they can't hold it, that they almost fall to one side. That needs to be something that should probably be evaluated a little bit further. Oh, my mouth is so dry. Sorry. So, if you don't mind, I'm going to kind of roll up your sleeve here. And we'll go ahead and check your reflexes. Okay. And I'll go ahead, and since I'm here, since we're doing something with your arms, I'll go ahead and check your radial pulse. Okay. Both are the same, 2+. Okay, and I'll check your brachial pulse on this side. Perfect. Okay, I'll kind of relax your hand. Relax as much as you can. Kind of on my arm there, okay? And radial area, radialis, excuse me, is the term. You want to hit the tendon in that area and kind of see the muscle flex. So relax it. Or sometimes you can see the thumb do a slight movement, a slight jerk. So, okay, your thumb moved. Yep, thumb moved right there, jumped. So you can see that you have a reflex there. And then the other one is, if you want to, if you could, we'll move kind of to this area. And we'll kind of move the camera over a bit. We'll move it. We'll have you kind of lay so you can relax your legs. Here you go. So we'll hit your tendon here in your patellar area. So you're wanting to see a visible jerk there. Perfect. Perfect. Wonderful. Yeah, maybe not for you. You're like, okay. Okay. And then the other one you want to check is the Achilles, and it's kind of hard to check. Do you mind to kind of turn your body and turn around and set your knees up here and dangle your back legs? All right, kind of sit your butt up a little bit so I can grab your ankle. Yeah, kind of like that. Perfect. And then so you want to make sure that they're dangled. And we'll go ahead. Okay, and the foot should move, backward or forward, and it does. Sorry. Perfect. And I won't make her do it, but go ahead and get on down for me. You also want to check on either side of the Achilles tendon. So you should have same movement, back and forth, back and forth. So if you want to go ahead and then we can take a seat again. Okay, kind of readjust the camera here. Alrighty. So, as far as arm and legs being covered with checking the pulses, kind of did that when we did the tendon reflex areas. So that way it was right there and visible. All pulses were 2+. Everything looks normal. Everything really looks good. Do you have any questions for me? Okay, perfect. Well, I really appreciate you sticking it through with me and, you know, letting me tease you and do this assessment on you and kind of doing the video for me. So that is my final head-to-toe assessment. And I thank Miss J once again. Thank you.